moderate to severe type of an injury, you might get that thing to bow about 45 degrees. You know, there might be a little bit of pain even with your more mild to moderate type of tears, but there shouldn't be too much of a significant, you know, give of the ligament. With an injury like that, if you wanted to rule in or rule out, you wanted to further confirm this, what special test would you do? What's that?
MRI.
Mm-hmm. And again, this would be one of those things, if it was a more moderate to severe, there's gross instability of that joint, you might want to brace the patient and then, you know, refer them out to an orthopedic surgeon, you know, and see what they want to do at that point. Sometimes, you know, unless there's a complete avulsion of that ligament, there are some conservative measures that they can do. Nobody wants to go get a surgery, nobody wants to have to get one, but sometimes it's a necessary evil. But there are things that you guys can do to encourage tissue healing and actually increase that healing time. So I put on here just, remember we talked about anterior shin splints? Mm-hmm. There's really no orthopedic test for anterior shin splints, but you almost want a muscle test for tibialis anterior. So you would just have the patient do a little, you know, dorsiflexion and inversion and have them, or have them, I'm going to put your foot in this position, you know, don't let me take it out of that position. And again, you're going to strain where that tibialis anterior originates from. And in shin splints, you know, that's going to be tender. Remember, we talked about if you go up the anterior shaft of the tibia and palpate, normally it shouldn't be tender. There should be no discomfort. But if there is, there could be, you know, shin splints. If you suspected shin splints, what are some of the complications that can happen with shin splints?
Depends on how old they are, first of all.
Uh-huh.
So if they're young, you're going to do them for orthopedic, check for tubercle, tendons, things like that.
Well, what are you thinking, more Oshkosh-Schlatters with that?
Mm-hmm.
See, that would be more, I wouldn't so much to suspect that with shin splints. But if something for like, you know, like a knee type of, like when we get into like the patellar apprehension or you know, patellar grind test. With shin splints, sometimes it is going to be younger people though, and it is usually your cross-country type runners, and that's where you want to make sure that there's not stress fractures. You know, because after a while it keeps pulling those fibers keep pulling against that periosteum. So, you know, an x-ray might show if there are stress fractures. If you suspect stress fractures, but an x-ray is just not hitting it, it's just not showing what you want to see, then a bone scan is going to be your most definitive way to see if there's any stress fractures in that area. And again, remember we talked about with shin splints, sometimes, what's the major problem with, when we talk about lower extremities with the feet, what's one of the major problems with the way with the feet? The pronation, yeah. That's going to be a major issue. So you want to check for pronation, you know, correct with an orthotic if that's the case. Also have them, you know, if they're starting to get shin splints, that tibialis anterior is extremely tight. So you want to start stretching that out, you know, and start strengthening some of the, you know, the soleus or the gastroc muscles too. It's all about that balance in there. If certain muscles are too tight and certain muscles are too weak, it's going to cause a strain on one area and a weakness on the other. Cross-friction massage, remember we talked about our ice massage is really good for that too. And also cross-training. We want to get these people cross-trained. You know, a lot of times with shin splints, it's going to be runners. And runners are difficult to just say, you know, you need to rest for a couple weeks or a couple days. So encourage them to cross-train. You know, elliptical or bicycles, something different. So patellar grind. Guys, remember how to do patellar grind? So with the patellar grind, what we both have, we have the grind and then the patellar apprehension test. And remember with apprehension, we talked about condylalation patella, which is softening of the kneecap or the patella. Also, with condylalation patella, there's also an association of that tracking mechanism. Remember, the patella is Some consider it a sesamoid bone, so it's an accessory bone, and it helps with the quadriceps. It helps act as a fulcrum. It helps the knee work a lot easier. So sometimes that groove, that patellar groove, is not hitting where it's supposed to in the knee joint itself. It could be disjointed. It could come off to the side. When it starts to track differently, sometimes that underneath of that kneecap starts to soften. Sometimes you can get that crepitus or that clunking or that locking in there. So with the patellar grind test, remember you're going to have the patient kind of forcibly push your knee down towards the floor. You're going to a little bit of overpressure on that patellar. And when doing that, there should be no abnormal crepitus or that grind or that clunk feeling. You know, if they do it and you palpate that clunking or that grinding in there, that's abnormal. You can also, remember, move that kneecap around, and it should move around pretty smoothly. There should be no clunking or grinding in there. And that's with the apprehension test. Remember, if they do have any knee issues, any dislocation issues of that kneecap, if you forcibly try to maneuver that patella, they're going to give you that, what are you doing, or get off my knee type of apprehension look to you.
And that's just in the moving of the patella?
Mm-hmm. Who's more commonly going to have tracking issues, males or females?
Females.
Exactly.
Pregnancy.
Mm-hmm. And that's why if you can help to correct that tracking issue, you know, remember where that tibial plateau or that tibial tuberosity is, it should line up mid-patella. You know, if not, there could be some tracking issues. So you want to try to encourage, if you notice an increase in that angle, if you notice that the patient, you know, has a tight IT band, you want to encourage that patient to try to stretch out that IT band, you know, and start to strengthen some of the medial compartment muscles like, you know, vastus medialis, gracilis, those type of things, because you want to try to correct that issue. If you suspected, let's say, chondromalacia patella, what kind of test would you order to rule that in or rule that out? Which would be a good test, and why? X-ray. Why?
Tissue itself
And remember, you can have them perform a sunrise view, and it's going to show you exactly how that patella is laying, if it's in the groove or off the groove. So why don't you guys try those couple of tests?
So is the grind do